Good afternoon. I'd like to call the special meeting of the BOCC to address emergency management related to COVID-19 and the local state of emergency order. Will the clerk please call the roll?
Good afternoon. Miller?
Here.
Hagan?
Here.
Kemp? Kemp?
Here.
Merman?
Here.
Overman?
Here.
Smith?
Here.
White?
Here.
And Ms. Wise?
I'm here.
Thank you. You have a quorum.
Thank you. Before we get into deep in our meeting today, a couple of things I want to say. HTV lost an institution there last night. HTV manager and an employee of 23 years, Mr. Fran Alisi, lost his battle with cancer.
No.
And I know it's tough on them, and it's so tough on all of us. So we want to give our deepest sympathy to his family and the HTV family on the loss of Mr. Frank Alesi, who had been 23 years here in this county as a great employee. Also, our county administrator lost her grandmother, passed away this week. She was 99 and a half years old. And Ms. Wise will be traveling to South Florida tomorrow to attend the funeral. So our hearts and sympathy go out to you also, Ms. Wise. So if you all don't mind, let's take a few moments of silence on behalf of Mr. Alesi and Ms. Wise's grandmother. Thank you very much. We're now moving to public comment. And we'll have to read the statement. The emergency management meeting welcomes comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to this group. However, it's required at the same time when you address this group that comments are not directed personally against any member, a staff member, or presenter, but rather directed at the issue. This provides a mutual respect between the group and the public. 20 minutes have been set aside for public comment, and each speaker has 2 minutes. Our first speaker is Chris Ann Hall.
Yes, Mr. Chairman, I am calling to urge our county commissioners to not expand this mask mandate. The mask mandate is coming up for question all across this country. There are now over 16 states who refuse to enforce a mask mandate. And you need to ask yourself, why is the governor not asking for a mask mandate? Why is the Surgeon General not asking for a mask mandate? Because they all know a recommendation is enough. The people of the state of Florida are responsible. The people of the state of Florida love their neighbors. They are considerate of one another, and it is not the proper role of government to mandate masks to begin with. Number two, the suggestion that we should mandate masks in outdoor use is also contraindicatory to the people's health. You have now evidence coming forward more and more abundantly that continued wearing of masks is harmful to people's health. This issue came up before the county court just yesterday, in which County Court Judge Barbas made the comment that he was very, very concerned to hear about medical experts producing evidence that long-term wearing of masks is detrimental to healthy people, not much less to those who are not specifically healthy. He even asked the question, why are we not hearing this from the county commissioner meetings? Why are we not hearing this evidence that masks are harmful to people's health in the public? It's time for the county to stop supporting their position with the echo chamber of doctors who just support the mandate. It's time for the people to learn that there are educated, trained, responsible experts out there.
Thank you, ma'am. Your 2 minutes are up. Thank you very much. Next speaker is Laura Curtis.
Hi, good afternoon. My name is Laura Kurtz. The 14-day average positivity in Hillsborough County was reported at 9.38% today. Thanks to the common sense mask mandate and the leadership of Mayor Castor and the Board of County Commissioners, this number is and has been in decline. The superintendent of schools just sent an email indicating that schools will open on August 31st. If they do, tens of thousands of children and staff will be returning. To quote a school board member, the opening of schools is a public health matter. As such, we need all hands on deck to ensure that COVID-19 cases continue to decline in Hillsborough County. We are asking for Mayor Castor and the Board of County Commissioners to please use all tools available to them to help reduce the number of COVID-19 cases in Hillsborough County as we prepare to potentially expose our most precious resources to the 3 C's: closed spaces, crowded spaces, and close contact settings, essentially classrooms. We also ask you to monitor our metrics closely and take appropriate action if and when our 14-day positivity changes. Thank you very much.
Thank you. Next speaker is Damaris Allen.
Thank you. Good afternoon. My name is Damaris Allen. In 1972, a Stanford psychologist started a study commonly known as the marshmallow experiment. In this study, children were given the option of one small immediate reward or waiting for a short period of time and receiving 2 small rewards. In follow-up studies, the children who waited to receive 2 small rewards had better life outcomes. They had better SAT scores, better BMIs, better academic achievements, and so on. This pandemic is beginning to feel like a mass-scale marshmallow experiment. Are we willing to make the necessary sacrifices now for long-term success? I'm a parent and I desperately want to see my children back in school, but not at the expense of public health. I also realize that we as a community have not done our part to mitigate the spread of this virus in order to allow schools to open safely. While I would love for everyone to wear a mask and be responsible and stay socially distant without mandates, we know for a fact that that isn't necessarily happening. Today, I ask you to take bold, necessary steps to mitigate the spread of the virus and lower the positivity rating in our county. This small sacrifice will have long-term positive effects on our community and our economy. In addition, I would like to see you compel all government entities to allow public comment by phone. We should not have to risk our health or the health of the community to participate. Thank you.
Thank you. Our next speaker is, hold on a minute here. Holt Kennedy.
Hi, thank you for allowing me to address you. I want to respectfully request that youth football and cheerleading in Hillsborough County and even over into the edge of Pinellas, because they were included in the recommendations that came out to all of our organizations on Monday from a joint group, respectfully allow us and our organizations and our parents to make the choice to allow our kids to participate rather than having it made for us. Hillsborough County Parks and Rec had a meeting yesterday where they decided to allow baseball and softball to go full competition because travel leagues and other leagues in the surrounding areas might hurt the local leagues and leave some kids behind. That's exactly what's happening with football. We've all put in return to play plans. We've jumped through 1,000 hoops. We've been out for several weeks conditioning with no incidents. You know, our coaches, our parents, our children want to play. Every other sport that's been out there playing, wrestling, that's skin-on-skin contact, wallowing around on a floor, basketball, soccer, they all have contact, and the kids are all around each other. But we're actually being punished while everyone else is being allowed to go forward. What I'm requesting is that we be allowed, as parents and as league administrators, be able to choose whether our children participate or not. On that note, we do appreciate the support, and we will have a large group getting together soon to continue to keep our voices being heard. In less than an hour yesterday, we had over 80 league administrators from football organizations around Hillsborough County join a group to find a way to come to you guys and ask for your support. So please let us support our children. They need this.
Thank you. Thank you very much.
Especially now.
Your time is up, ma'am. Thank you. Mr. Brewer, Mr. McElroy, was that our last speaker?
No, sir. Jesse Thompson is available on the line, and he will be our last speaker, sir.
Okay, Mr. Thompson, you recognize.
Hey, good afternoon. Thanks for taking
Ms.
my
Thompson,
call.
I'm sorry.
I understand. You're okay, no problem. I understand there may be some discussion later about lowering the age limit for young children who are subject to the mask mandate. And we know that children will already be subject to the mandates in school. I'm referring to the mandate for children in public. I ask that the age limit stays where it is. There's a very small percentage of 4 and 5-year-olds getting the virus compared to the rest of the population, and little evidence that they're transmitting it. I don't feel the data supports adjusting the age lower. And we know our neighbors in Pinellas County have 1 million residents, and the age for mask mandate there is 18. With no mask mandate for anyone under 18, their percent positive numbers have been below 5% for several days over the last couple of weeks, and has been low overall versus Hillsborough. And I would encourage you to ask Dr. Holt 2 yes or no questions. 1, will lowering the age for children to have to wear masks have a significant impact on slowing the spread of the virus in Hillsborough? And 2, are 4 and 5-year-olds responsible for significant transmission in Hillsborough? Hillsborough's numbers are already trending in the right direction, and the community is coming together and doing well. There's no need to add stress and anxiety to us struggling parents as well as our children when the data does not support any benefit. Thank you for your time and consideration.
Was that the last person?
Yes, sir.
Okay.
That concludes public comment.
All right. Okay, thank you. We now move to the emergency management update. Mr. Dudley.
Good afternoon. During this week operational period, we focused on community testing and hurricane preparedness. We continue to move forward with testing with 5,061 tests conducted last week, over 90,000 total tested using the Hillsborough County community testing sites. Over 3,400 appointments scheduled for this week. We continue to see the demand for testing trending downward. Since the peak we saw the week of June 28, we're down about 53% on demand for using the county testing sites. Based on this information and the observation for the demand, Lee Davis, Plant City, South Shore will be transitioning back to 3 days a week for testing. This will allow us to maximize use of personnel and receive the best value for contracted staffing. Lee Davis and Plant City will be Monday, Wednesday, and Thursday with hours from 8 to 4. South Shore will be Monday, Wednesday, and Saturday with hours being from 8 to 4. USF testing site open today. This site will operate Monday through Friday from 9 a.m. to 12 p.m. This will have a capacity to book up to 140 appointments daily starting out. Again, that'll be on the USF campus. You'll be able to find that information on our Stay Safe webpage for testing. Raymond James update. Raymond James will start offering antibody testing along with self-administered COVID testing starting tomorrow. So antibody testing will be available tomorrow at Raymond James. They will have 200 tests available. This particular test will require blood draw. People who get the antibody test will also get the COVID test. The antibody tests, they will receive those results the same day. We will begin operations to conduct testing of 18 housing and urban development properties in Hillsborough County sponsored by Tampa Housing Authority. The 18 sites comprise a total of 557 individuals, including 351 individuals over the age of 55. We're working to assign mobile testing teams to schedule these sites, and they expect them to be completed over the next couple of weeks. Next available appointment is 14 August, and our turnaround times, again, are looking between 3 to 6 days. Logistics, we have no PPE or testing kit shortages at this time. We have 1 guest checked in the isolation site, 7 in the quarantine site, and 1 guest in the transitional site. Hillsborough County versus our partners in testing. We wanted to make sure we provide you this. This question has been asked before. Just out of the new testing sites, USF will make the 9th testing site offered by Hillsborough County, with Raymond James being a sponsored site. We're conducting about 29% of the community testing, along with various partners. They've been absorbing the lion's share of 71%, and that's where we want to see that trend go. We want to transition from these tactical sites and help our healthcare infrastructures reabsorb this task, so we continue to move in the right direction as the demand for the county testing sites are trending downward. We will continue to adjust testing capacity in response to increased testing demand as PPE supplies and staffing permits. Hurricane preparedness. This week, the Office of Emergency Management hosted a virtual workshop with partners covering shelter operations based on social distancing objectives. Several options are available based on various levels of storm severity. For example, we may open all shelters for a limited evacuation so as to provide social distancing. We are also looking at additional facilities that may be available to shelter or refuge of last resort. We have updated plans for this year based on the pandemic. We have supplemented existing plans with pandemic considerations addressed for each of the functional areas. Communications and digital media finalized the annual disaster preparedness guide. We've distributed over 138,000 guides and provided messaging to various stakeholder groups and the public. The public messaging will be used to update residents on our plans, and we'll stress they look for alternatives to using county shelters, but they will be available if you have no other options. While hurricanes would adversely impact all local operations, including the pandemic response, plans will be based on the assumption that we will continue to support pandemic operations under a unified command approach, along with our DOH partners. Personal protection will be considered in all aspects of the response and service delivery. The pandemic has provided OEM and our partners with an opportunity to test and develop many new processes and tools, while at the same time getting extensive experience with a prolonged EOC activation. This will help make a hurricane or other response run more efficiently. This concludes my update. Any questions?
Okay, thank you, Mr. Dudley. Ms. Commissioner Overman, you recognize.
Thank you, Mr. Dudley, for this report. Thank you, Chair. I really appreciate you adding the slide that shows the 71% of the tests conducted that week were from community partners, which is great, but we've seen a decline in county testing. I don't know whether it's the Department of Health or whether or not you're able to track, but have we seen a correlating decline in the number of tests, total tests offered in the community partners as well? So it looks like we're trending down at the county level. Are we also trending down in terms of testing as far as the community partners?
I don't have that information. I haven't taken a look at that trend. I can take it for action if DOH is unable to follow me behind that question. So I can look into that.
Okay, I'll wait and confirm with Dr. Holt if that's a possibility that we can show those two numbers. Thank you very much for your information. You're very helpful. And thank you for all the work you do. Bye-bye.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. Thank you to Tim for all you do to help inform our residents about everything that's going on out there. I've had several requests from constituents, especially those that are at risk of being evacuated if a hurricane would come. And their question is, and wonder if you could just bring a report back at our next meeting about the emergency shelters. And are they going to be the same? What changes are taking place in the emergency shelters? How many are you having to open more of them? I think they're interested because of sanitation issues, social distancing, wearing masks, the separation. So I guess you don't have to answer today, but wonder if you could bring all that information back to us at our next meeting.
Absolutely. We'd be happy to provide that update.
Thank you very much. And thanks for all the work you do. Thanks.
Okay, Mr. Dudley, thank you very much for your presentation. Thanks for everything that you're doing. We appreciate it very much.
Thank you, Mr. Chair.
Public health update, Dr. Holt.
Yes, hello, commissioners. This is Dr. Doug Holt, Florida Department of Health, Hillsborough County. Today, we're going to begin with the presentation by Dr. Kami Kim who will review COVID testing. Seems like every day there's either a new test or a new way to collect some of our tests, and I think she'll be very informative. And then, as always, we will review the epidemiologic hospital data. I'll make some comments, and then Ms. Emilee Brooks will review the actual dashboard. Just to begin about the question from Commissioner Overman, this is, I know, been asked repeatedly. In fact, I think we received one jointly from the county this week, and I replied, and I'll continue to reply. We do not have information on how many tests are being collected. We get the number of results that come in. In fact, you could have tests that are collected in Hillsborough County, but if they're done on a Pasco resident, they'll go be reported to that county. And in addition to the availability, I have engaged, and we've been talking within our hospital partners, which are some of the major providers. As we did many months ago, we got an estimate through their cooperation. And I think along with Mr. Early, I'll be happy to make an additional request to see if we can provide at least a better idea of both what their availability is and what's their demand. So I will do what I can. With that, let me begin by introducing Dr. Kami Kim. She's a Centavante Endowed Professor at USF College of Medicine. She's also the Division Director of Infectious Disease and Internal Medicine. She runs research labs at USF that actually do include some PCR testing. She will provide us a review of COVID testing. Dr. Kim?
Dr. Kim, you're on mute. Unmute your mic.
Dr. Kim, I have unmuted you. Go ahead.
Dr. Kim? I think she muted herself again. There you go. You're unmuted now, Dr. Kim. You can proceed. I think she might be having some technical difficulties. Dr. Holt?
Yes, sir. Would you like us to do our presentation and at the end to see if
why don't you do your presentation and then we'll come back to her, see if she might be having some technical difficulties.
In the meantime, I will provide the call-in number for her. Maybe she can call in.
Thank you.
Yes, Ms. Brooks, would you put up our presentation, please?
Yep, I will share it right now.
Thank you. Before I begin, I want to actually shout out, thank you to Commissioner Kemp. She connected me with Dr. Jason Slamey he's a faculty at USF College of Public Health. As a sideline, he has created his own dashboard and has a lot of great insights. He's provided some constructive suggestions, but he also made note that he was very complimentary of the team for creating an understandable but also in-depth presentation of the appropriate information. Mr. Wagner mentioned that a comment that I made with him is we make each week at this meeting that we didn't really create a scorecard on the dashboard. It doesn't have a red, yellow, green. It's a salmon and a green to say if things are changing. We chose to avoid defining specific thresholds for red, yellow, green, as often these are there's a lot of disagreement at times about what you set. Although I did introduce the step down, which gives us at least a reference point for the level of community-based transmission. And that's about as close as we're going to try to get to just sort of a scorecard. So, and then just a coming attraction, we'll be working with Dr. Curran. We're looking at how to select and present data to follow over the next few months as both schools and university open. Ms. Brooks, would you go to slide 2, please? We have added 233 cases today, so we are up to 33,428. This is an increase of 6.4%, but this is the amount of increase is decreased significantly. Overall, the population known to be infected, they've been tested with either a PCR or antigen, represents 2.3% of our population. Percent of people, the entire population who've died from COVID is 0.03%. This represents 431 deaths. The number of estimated number of recovered, which again, just as a reminder, this is that those that have been positive more than a month but haven't been reported as dying has increased and will continue to increase fairly significantly. Went up 5,000 now to just over 19,000. Looking at our trajectory, our cases have shown a 31% decrease looking at a daily on a 14-day average. We're now at 357. And if you look at the dashboard, when you'll see it, our 7-day is even lower at 288. This translates into a rate per 100,000 on a 7-day basis of 140. And as we'll see later, this is the metric that is used to determine the level of community-based transmission. And with this decrease, we've gone from what the CDC terms sustained uncontrolled to sustained controlled community-based transmission. Again, as we mentioned, this is the result of our community continuing to practice our 3 C's. I think we all know them: facial covering, avoiding crowds, and especially closed spaces, which we like to emphasize. The more experience we've had with this virus over time, closed spaces are critical, and they've created a mnemonic, the 3 V's, and it's about the venue, ventilation, and vocalization. So small places, poor ventilation, and loud places should be avoided. Looking at our number of testing, as Mr. Dudley noticed, there's a flattening, a slight decrease over the last 14-day average. And again, that's of concern and also been noted throughout the country and the state. But again, as he noted, though, with this reduction, the timeliness has improved. We're seeing from our epidemiologist report, typically a 5-day return versus the 7-day we were seeing previously. The positivity rate, as noted, for 14 days is now under 10%. And just looking at my own 7-day calculation, we're at 7.2%. Next slide, please. Across the board, our hospitals are looking better. The number of COVID positive patients in the hospital has decreased 22% on a 7-day period. We're average now 381. The occupancy of the both total beds and ICU is below the 80% occupancy that when it's exceeded, we begin to worry. Admissions are also down notably 50%. Deaths, we are at 431, and that includes 31 that were reported yesterday. Again, as a reminder, the date that is being reported of the date of death is not the date of death. That requires the completion of the process of the medical examiner to determine the cause of death. With that, I'll turn it over to Ms. Brooks to go through our dashboard.
Let me pull that up, sorry.
Oh, I'm sorry. I apologize. I added 2 more slides. My fault. I'm in an old habit. Emilee, would you do number 4?
Yes, I will.
So looking at the step-down benchmarks, we are out of what was termed the red. We're now into the orange at 140 cases on a 7-day average per 100,000. This is a rather sharp decline as the number of cases that were reported, 8, 9, 10 days prior have been replaced by our more recent with significant reduction. So associated with our stable to reducing our positivity rate and our flat to stable testing, I think all of this is very encouraging. Next slide, please. I wanted to also give show a regional perspective, and what this graph shows, it's a 7-day rate, same rate we just talked about per 100,000, but also included the positivity rates for our surrounding counties. The orange, the red line at the top is the orange line at the top is that threshold that we have now just gotten under. And we're trying to achieve the yellow, which is the next step, and then we'll get down hopefully to the green. So for Hillsborough, we're at 140 cases per 100,000 on that 7-day. Our 7-day positivity is 7.3, and as you can see across the board, we're really comparable to our other counties. Polk is a little bit of an outlier only because they had a later surge than us, so they still have a large high numbers, but they are trending down and hope to see that continue to join us. And then lastly is the state comparison. This is driven mostly by Miami-Dade and Broward, but they are also coming down, fortunately. With that, I apologize. I will turn it over to Ms. Brooks to provide the dashboard review.
Thank you, Dr. Holt. Let me pull this up for you guys. All right, can everyone see that? Okay, great. So, good afternoon. Oh, sorry.
Need to go back to the slide.
Emilee, it's showing
There we go.
Sorry about that. So good afternoon. My name is Emilee Brooks. I'm a business analyst for the Healthcare Services Department. I'm going to be presenting a brief overview of the County COVID-19 dashboard. So first, the landing page displays the COVID-19 benchmark summary. The first row on this page presents the total case data. So as of 8/11, we have 33,198 cases, 431 estimated fatalities, a 1.3% fatality rate, and 20,014 recovered individuals. The next two rows present the benchmark metrics. The data highlighted in green indicates movement in a positive direction, and the data highlighted in red indicate areas that require attention. So here we see our 7 and 14-day rolling average of cases are continuing to decline. We're below the weekly test target. Our percent positivity is steadily declining. Our hospital census is steadily declining. Our hospital percent occupancy is declining. Our ICU occupancy is declining, and our hospital admissions are declining. So moving to page 2, here we can see the case summary data. In the top row, we see the cases by gender, age group, and the hospitalizations and fatalities by age group. In the cases by age, we see that a large number of cases are in that 20 to 30-year range. And for the hospitalizations and fatalities, we see the numbers skew more to the older age groups. In the chart below, we can see the case summary by day. Here we can see the 7 and 14-day averages of new cases have been declining over the last few weeks. And the latest 7-day average is 288, and the 14-day average is 357. I move to page 3. Here we see the testing summary data. So in the top row, we see that the estimated percent of the population tested is 21.22%, and the percent of confirmed positive cases is about 2.3% of the population. So in the testing summary by week chart, we can see that our total tests reported per week have been steady, and the number of positive tests reported is slowly declining. The 7-day and 14-day average of percent positive tests are both steadily declining. And so moving to page 4, we see the hospitalization data. So in this first chart, we see that around 25% of the COVID-19 hospitalizations are ICU-based, and around 75% are inpatient-based. We can see that our COVID-like ED visits by week are steadily declining. The FDOH COVID hospitalizations by age group are skewed toward the older age groups. In the hospitalization census, we can see that the combined ICU and inpatient hospitalizations has been declining over the last few weeks, and the latest 7-day average being 398. Lastly, in the hospitalization admissions chart, we can see that the combined ICU and inpatient admissions have also been declining over the last few weeks, the latest 7-day average being 26. And that marks the end of this review, so I'll stop there. Thank you.
Okay, thank you. I have a question, maybe a couple of questions. Dr. Holt, did the White House itself put out a recommended level that we should be at a positivity rate before we start opening some things back up? Am I correct?
Yeah, I think this, if I recall, know what you're referring to, I believe the CDC through the White House put out some guidelines that they would do similar to what they did for the reopening of the entire country.
Okay, and I believe that was 5% positivity rate. Does the state of Florida, and I'm not trying to put you in a precarious position here because I understand where you are, does the state of Florida have that same positivity rate?
The state of Florida has not set or defined a rate that would that needs to be achieved to make that decision.
So then it appears to me that our 14-day rolling positivity rate is 9.38, which we must admit is coming down some, but the CDC through the White House is saying that we should reach the 5% positivity rate. And I just can't quite understand how our public schools, specifically in Hillsborough County, is now saying we're going to push back a week with e-learning, and then on the 31st, open up schools, brick and mortar, and we're at 3.98% positivity rate. I don't know how in the world in 2 weeks we're going to get down to 5% positivity rate. Is that achievable to get to 5%? I hate to put you on the spot again. Before by August the 30th?
Based on the projections, and I think if again, it's really has been a tough last few weeks. The reopening of the schools due to the recent surge and widespread transmission, which is finally decreasing, created a lot more risk in August or now than there was in May. So looking ahead, we presented, or the elected officials heard, which I think are best situated in making the decisions about what's best for them. They were informed, and if anyone, if you didn't attend the school board meeting, I'd encourage you to listen to the meeting through the transcripts. So they did review the risk of opening, risk of not opening. There was some disagreement on the facts, but generally it came down to the level of risk which you're wanting to accept. And the prediction that was given would be that we would be around that percentage in the 1st of September. I can be hopeful we will see that sooner, but I think if the community continues to do what they've been doing over the last month, and we continue to see that, we're going to continue, hopefully, to get closer and closer, but I cannot make a certainty.
You just triggered a statement. If the community continues to do over the last month, 30 days, the numbers are coming down, then we may in the next month reach the 5% positivity rate. Schools have opened in this country in 5 states. 2,000 students and faculty have either been tested positive or been quarantined for 14 days. And we're at 9.38% positivity rate. And when the school board met last week, they got expert opinion from the science people, the people that study science, the medicine, that said it was not in the best interest of Hillsborough County schools to open. And now we're talking about opening up on the 30th, and we had 9.38% positivity rate. You just said a month. That is not a month from now. We're talking about 2 weeks from now. This county commission is not the school board. But we took an oath to protect the citizens of this county. Every one of them, be them from 8 to 80, blind, crippled, or crazy. Our oath was to protect each and every one. And I just cannot understand why we're looking at this and our positivity rate at 9.38%. And we as a county commission, we can't control what the school board does, but we can have some major concerns, because the mere fact is that in our oath, we took to protect the well-being and safety and health welfare of every person in this county. And it truly, and I'm not speaking for other county commissioners, this is Les Miller, truly have a concern, because I don't think we can get there in 2 weeks at 5%. Just don't see it.
Commissioner, if I may make one additional comment, that if we get there in 30 days or whenever, we have to keep going. Reopening schools, universities, and others are going to be a challenge. So it's not about getting across 30 days as our finish line. It is just the beginning of what we need to do for really the rest of the year. And that's my opinion. I'll stop there.
Okay, and I just was reminded, Superintendent Davis will be before us next Thursday. He will be here next Thursday. But and I appreciate Dr. Holt very much, all the work that you've done. And I didn't mean to put you on the spot, but I just had to have the questions asked, because it really concerns me as what we're getting ready to do. I think we're getting ready to have a real bad situation here, especially with a positivity rate at 9.5%, and the CDC is talking about 5%, and it even came out of the White House. Commissioner Overman, when you recognize.
Thank you very much. Thank you, Chair, for saying those words. I've been on that same page for quite some time, and later in the conversation we'll be talking about our children and the standards that we set as far as our emergency policy order. But Dr. Holt, in the words that you spoke at the school board meeting, there were several things that were discussed. One is contact tracing, and it's your partnership with the schools. And then the other is maintaining the standards that are necessary to keep return to school brick and mortar from creating a surge that we're concerned about, even if we got to that 5% level. So my question to you is twofold. Can the Florida Department of Health create a dedicated testing and contact tracing team to allow for an immediate response or a full notification, not only to the state, but also to schools and parents, in order to avoid or immediately address what could possibly be a super spreader event? And then I have one question after that.
I think, as I've mentioned, we have or created that dedicated team, and it is matched and even augmented by the school district, which is also going to expand both their nursing. They have a COVID experts, they have liaisons, they've got a data system where they can collect information that will help us know where the child's been. They've been around. They know best. So it's all about speed. The testing is a challenge. I'm not going to make any bones about that. And we're exploring new options, and hopefully there'll be advanced options that will give us things that we can't do now. Testing either on site or something along those lines. So I can assure you, we are working on both the processes and getting the people together so that they can communicate and quickly respond, not just to a known case, but we have to be able to respond to a suspect case of an illness to quickly and determine whether that is indeed COVID or not. And I'll stop there.
Thank you very much for that. And I do recognize that, once you have an exposure in a class, it's going to be difficult. I had referenced, and it's part of today's package, the Pediatric Institute's guidelines for opening schools. And in that report on page 5, section 4, talks about children and teachers should maintain a distance of 6 feet from each other in classrooms and should not be in groups in which they are facing each other. And then it made reference of students above the age of 5 years old. Teachers and school staff should wear masks while in school, which is to be addressed later on in our agenda. But what isn't in our agenda is the issue associated with schools keeping children 6 foot distanced in their desks or in their seats in their classroom. In working with the school district, have you addressed the recommendations as far as distancing in classrooms as in their seats, given that they're in the class for longer than 15 minutes?
Yes, ma'am. Yeah, the guidelines, in addition, those guidelines and others, the school district has really been outstanding because they have actually, in addition to us, we've worked with experts at the College of Medicine, USF, and Tampa General, which they actually have contracted with to provide that additional guidance. And the plan has every intention and design to achieve those goals. I cannot, and I will speak for them, but in reality, it's impossible to do that all the time. And they're doing everything they can to approach that goal. And I think Superintendent Davis and his team deserves credit, and they could probably speak more specifically to the strategies. They have released a plan that is comprehensive, but is continuing to be refined. That's, they're all doing the best they can, but that's a standard that's, you can't realistically probably expect every school and situation to achieve that. I'll stop there.
Yeah, and that is my concern. We're being advised that we need to get under 5%. We're being advised that they're planning on opening, and we're being advised that they're doing the best they can when it comes to the 6-foot distancing in classrooms that historically have had a little bit of crowding issue, too many kids in one classroom on a good day without COVID, and air conditioning problems and ventilation problems that are going to exacerbate the circumstances in many of these schools. So I do have grave concerns about the school opening at full capacity, and even at 50% capacity, it's going to be quite a bit of a challenge. So I hope that working relationship you have with the school can help them make the best decisions. And then I implore our commissioners to recognize that we do have a responsibility to protect all of our citizens, including our teachers and our students. So I'll stop there.
Commissioner Kemp, you recognize.
Commissioner
Yes.
Miller, this is Commissioner White. I'm on via phone. I would just like to be recognized at the appropriate time.
Okay, Commissioner White. Commissioner Kemp, you recognize.
Thank you. I believe we're in for a world of hurt in Hillsborough County. The decision that was just announced, and I appreciate your words very much, Commissioner Miller, but I do think there was one thing in them. You laid this, you said the school board. The school board never made this decision, as we all know. The school board voted 5-2 to not open the schools for another month. Why some announcement without a school board meeting is being made that the schools will open to brick and mortar? As an attorney, I consider this to be unconstitutional. I mean, it's very clear. Article 9, Section 4B of the Florida Constitution says the school board shall operate, control, and supervise all free public schools within the school district. That is the law. How this unconstitutional takeaway, a declaration without the board making it, I can't understand it at all. I think it's a usurpation of constitutional authority of the school board. I'll just say that first off on that. But in terms of the health and safety of this, Commissioner Overman just spoke to social distancing in schools, and at this time, the superintendent is having a press conference simultaneously and just said, quote unquote, that in education, social distancing doesn't exist. So, I think we need to recognize that. As to the 9.38% positivity rate. The Florida Pediatric Association sent us all a letter weeks ago saying that we need to get down to 5%, preferably under 3%. I will tell you that in New York City, they are at 1%. That's what they're dealing with, and they're doing it very safely, very closely. I think we need to recognize several things. One is that Florida is second in the nation with over 500,000 cases of COVID-19. We're the only state leading us is California, which has twice the population. We have 20 million people, they have 40 million people, and they're only slightly leading us. We are doing terribly in every single county in Florida, but there are 5 counties that are standouts and 5 that are have very high case loads. And those are the 3 counties of Miami-Dade, Broward, and Palm Beach. Those counties have all been designated by the governor as being phase 1, and they made their own choices months ago about whether or not to open their schools, and they have, as I understand it, decided not to in Miami-Dade and Broward. 2 other counties are equally in the category of being in a terrible state, very much separated from the others. Those counties are Hillsborough and Orange County. We have over 30,000 cases. We are very distinct and very close to West Palm Beach in our number of cases and our issues. Yet we are not in these counties. They're trying to strong arm into opening these schools and this will be such a we are just now getting our cases down, and this is going to put us at such great public risk. And our group, this puts this school issue at our doorstep. I would just say that this is going to be a terrible situation for us. I know that we don't have jurisdiction over this. This is the issue of the school board, although it was taken from them, and I don't see how. But I would say that we should at least, I think, here, pass a resolution in support of the school board letting this go for another month, not opening brick and mortar because of the grave public health the threat it will make to this community of community spread, and that we should do all we can in support of the school board members to make this determination based on science that they heard, and I listened to it last week as much as I could. Those doctors all said that they should not be open. This is a terrible decision for Hillsborough County. So I'd like to make a motion that we do a resolution in support of keeping the schools closed for another month until we get this situation under control.
Commissioner Kemp, I understand your point. I think you heard what I said also. I did not say the point that I don't know how an appointed person tells an elected body what to do. But I'm going to ask you that we do not do a resolution. I think they're getting a message from us. I think the entire county is getting a message from us. We are not the school board. We want to support our school board members. But I think a resolution just puts us in the middle of a dogfight. We don't want to be into that kind of a mud right now. So I'm going to ask you not to do a resolution. Don't mind, please.
I'll take it back for now, but I think we really need to make a very, an appeal to the governor. This puts it right at his doorstep in terms of, where he has put this county. And we are number 4 in the state for coronavirus cases, and we're not being able to take the health measures that we need to keep this down.
On a daily basis, Commissioner Kemp, sometimes we're number 3 because we have more than Palm Beach has.
Yes,
okay?
Right. Mm-hmm.
But the messages we're saying today, I think they're hearing us. I hope they do. But the resolution, let's just hold off on that.
Okay.
If you don't mind. Okay. Mm-hmm. Commissioner Smith, then Commissioner White. Commissioner Smith, you're recognized.
Thank you. And Commissioner Miller, you said you were not speaking for the board when you spoke earlier, but I want you to know you're speaking for me. Every word you said, I couldn't agree more, and very well said. I want to clarify something as we're as we mention this positivity rate, and we're 9.38%, and the WHO and the CDC and the Florida Pediatrics Association have all said we should be at 5%. But it's important to notice that they say we should get our positivity rate below 5% for 14 days before opening up. Okay, so it's not just like one day we have an anomaly and we have a lot of testing that day and the positivity goes down or something. They want to see, and they all recommend below 5% for 14 days. So just to be clear on that before we open. And I was also, shocked by the information that we're just seeing today, that the superintendent is calling for an opening of the schools weeks earlier than the school board voted on. I cannot fathom that myself. I understand what Commissioner Miller is saying, that we need to tread very carefully on the jurisdiction and stay in our lane, but I want to certainly add my voice to the opinions that have been expressed that that is out of line to overrule elected officials. They voted for 4 more weeks after the 24th of virtual learning before opening the brick and mortar. I don't see how that gets overruled anywhere else. And I stand opposed to either the state government reaching down and overriding that in any way, as well as any other appointed officials. So if there's any consideration possibly later about and I'm getting a little feedback, but if anybody wants to consider at some future time a letter of support for our fellow elected officials in the school board or their position that they voted on, possibly that might be appropriate. I offer that as a suggestion. Thank you.
Commissioner White, you recognize.
Thank you. Well, I'd like to offer a different perspective on brick and mortar school. I think it's incredibly important to have brick and mortar school sooner than later. Kids are going to benefit from the in-person experience with the teacher in the classroom, socialization from their peers. The list goes on and on and on. So I'm in favor of having brick and mortar school sooner than later. Also, just to pick up where I left off on my comments on face masks at the last meeting, I think we need to move away from this divisive issue of face masks. In fact, I was just reviewing a study from The Lancet, which is a highly respected medical journal. And as I read the data is not very strong in favor of cloth face masks. The data is stronger on social distancing. And in fact, if I'm reading the data correctly from the study that I reviewed, the data on cloth face masks seems to be on par with the data on eye protection. And we have not mandated eye protection in Hillsborough County. So again, that's a divisive issue. The data's not real strong on it. I just think we need to tread lightly and use caution on that divisive issue. I would like to ask Dr. Holt a couple of questions. Dr. Holt, I'm the only healthcare professional on the board, and I've had a lot of people in my ear about whether or not there could be any issues with the proper oxygen CO2 exchange with face masks. As you know, if you're not getting a proper oxygen CO2 exchange, it can lead to a host of issues, including issues with, such as the imbalances of pH in the blood. So I'm just wondering, have you seen any data or have you heard anything anecdotally or otherwise about any issues that might arise from that? And then I'll hold for my second question.
Yeah, yes, Commissioner. There has really been a lot of studies, a lot of it late, where they have looked at the impact of oxygenation on the wearer, and across the board, at least the preponderance. There's, when you get into studies and research, you can find one or two or some differences, but you start looking at the consensus and there is no reduction in the level of oxygen coming out or the ability to exhale the carbon dioxide. The biggest difference between a face mask, if we think about the way they're being used, and social distancing is the cloth face masks are just intended to reduce the amount of virus that is circulating in the air. The social distances are there to protect the reduction in the infection of a person between someone who's infected to someone who is not infected. So the facial masks are not really designed to protect the wearer. It's to protect all the people that they would be around. And that's becoming more and more important in these closed space type of areas where the virus seems to accumulate in the air. And I'll stop there.
Okay. Dr. Holt, can you provide us with a sampling of the data on that respiration issue, maybe a sampling of a couple of key studies from both sides of the issue?
I certainly will provide yes, I think I can provide on both sides of that. Yes.
Okay. All right. I really appreciate that. And then the second question I'd like to ask, or the issue that I'd like to bring up is, I am starting to see in from some reputable sources that there may be issues with inflated death rate numbers as it relates to COVID. I'd like to ask, maybe it's Dr. Holt, maybe it's a member of our staff, but I'd like to get someone's take on that and just, get a feel for, whether or not that's going on at any level at all. If so, how widespread might it be? And I'll stop there.
This is Dr. Holt. I have, it's been a while, but we did have a presentation from Dr. Devers, our medical examiner. She might be the best person, at least to talk about what we do in Hillsborough County, or what she does as far as the relates to what deaths are reported from someone who has or has not, who does have COVID. Are there situations where someone died of something else, some other injury, like a car wreck, who happened to be COVID positive, or she has explained a little bit about that, but if you wish, I'm sure she could come back and talk a little more. Ultimately, she's the decider, and I'll stop there.
Okay.
Okay. So.
Sorry.
Well. So, what I'd like to get at here, though, is, can there be situations where an institution maybe has a financial incentive to inflate COVID death rates, or even COVID, well, I'll leave it at that, COVID death rates?
Could you repeat that? Mr. White, could you repeat that?
Is it possible that there could be situations where institutions could have a financial incentive to inflate COVID-19 death rates?
So are you saying that there would be
numbers?
That you're saying that some institutions, and you didn't name any, would inflate death rates to gain money? Is that what you're saying?
I'm just asking if that's possible, or if that's a concern.
This is Dr. Holt. There has been an enhanced payment to nursing homes if they're COVID positive or not. There has been, I think, some reimbursement if they are caring for a patient with COVID in the hospital. They wouldn't get paid by a death rate per se. It would certainly just be because of the additional cost to take care of someone. In all honesty, I can't envision how the benefit to that would be, lead to an outcome of deaths, and whether I think I would feel trustworthy or confident in the integrity of our local hospitals and our facilities to do the right thing. But yes, there is an enhanced payment by the national government regarding caring for people who have COVID because of the additional costs associated with that. And I'll stop there.
Okay, so I guess then I'll just ask one final. Yeah. So I guess I'll just ask one final question. So what if someone presents to a hospital for, treatment of, you name the ailment or the condition, and they die at that facility, and the cause of death is ruled to be, or determined to be, from COVID-19. I mean, is it possible that in that scenario, there could be some increased or enhanced reimbursement or financial gain.
Dr. Holt.
I can't comment on that, but I can comment that Dr. Devers has talked to some degree about kind of the opposite, where she will test people who she actually thinks died of COVID, but they're not reported to die of COVID because COVID could cause odd deaths like pulmonary emboli and heart attacks. And if the person wasn't tested, then it wouldn't be, but she tests what she describes as post-mortem. So I know of that as an actual occurrence, but I can't comment on what you just described.
Got it. Okay.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. Actually, I'll make this very brief because the questions have been long and they've been very informative. I want to just ask Dr. Holt. I know you still have your healthcare committee, right, with the hospital directors, yourself, and other people. Is that still going on? Y'all still meet once a week?
Yes, ma'am. We, under Jean Early and I have what we call a surge meeting. It includes all of the representatives of all of the hospitals in the Hillsborough County.
Right. Right. Well, I mean, I'll say for myself, I mean, the numbers are still too high and positivity rate, but I mean, I'm still going back to the same conversation I've had the past couple of weeks, like our exit strategy, but it more relates to, if you ever look at graphs and charts over time, you'll see where the accepted level of risk would be or outcome. Do you all discuss that, or can you discuss that within your group and come back to us with what you feel is the acceptable level of risk in Hillsborough County? And that is on cases, hospitalization, death rate, positivity. Because I think we can sit here and look at these numbers, look at these figures, but a lot of people ask, like, when are we going to get back to normal? And I think it's up to us to tell them, well, we still are at risk. And here's the numbers, and here's what we're basing it on, because we base our decisions on data. So I guess I just want to ask you if you can go back to your committee, discuss it, come back to us and tell us what you all feel is the acceptable level of risk.
I'll certainly put that on the agenda. I think it was actually discussed a little bit at the school board meeting. I think Dr. John Green did a great job. Said basically that it is what your individual degree of risk tolerance is. And there are going to be differences. So collectively, again, I think the school board made an informed decision. But I will ask if there is a consensus around our other healthcare facilities is exactly what is their community-wide assessment of an acceptable level of risk. I'll stop there.
Okay, I do appreciate that because people are really starting to ask that question. And I think we owe them an answer. We need to, again, still base it on data to be able to go forward. And I do appreciate everything you do, Dr. Holt. You're working hard. You've been with us from the beginning, 5 months. So yeah, you're doing great stuff.
Okay, we're going to move on. We're going to move on to the next. We've been on this a long time. We're going to move on to the next. Did Dr. Kemi Kim ever get on the phone or?
I'm here. Can you hear me?
Oh, there you are.
I had some technical problems. I was going in and out. So, but I am here now.
Yes, ma'am. Go ahead. Make your presentation. Good afternoon.
Don't you need to enable me to share my screen?
Mr. Brewer?
Yes, ma'am. You can share your content.
It says, wait a minute. Maybe it's working. according to, it doesn't indicate that I'm the presenter. Maybe my app is having a problem.
Let me.
Now it does. Screen. Okay. And then, can you see this?
Not yet.
All right, hold on. Share. Well, let me see. Oh,
here it comes. There it is.
That's worked. Okay, good. All right. First obstacle solved. All right. Okay. So I'm going to go over the basics of testing. I know you all have been through this from the beginning, so much of this you probably know. But even for those of us who are professionals at this, it's very confusing. And sometimes based on new data, we change our mind about things. So I'm going to go from the beginning, and I apologize to those of you where it seems a little bit too basic, but I think if you lose people from the beginning, and then obviously the more nuanced comments that will happen at the end, they won't understand. So in any case, so I'm the director of the Division of Infectious Diseases and at USF. And throughout this from day one, I have basically lived at Tampa General and have worked very, very closely with the Tampa General administration. And as you know, Tampa General has done an incredible job as far as managing patients, bringing out testing and things like that. So Dr. Holt asked me to speak about, you know, my views and, you know, that are going to be influenced by my experience. So I think you know all this, but COVID-19 is caused by the virus SARS coronavirus 2. On the left is a schematic of the virus, and the testing for this virus is based on either a nucleic acid RT-PCR test for the viral genome, and that is very, very sensitive. And the major limitation of it being so sensitive is that virus that may be around, you know, the host killed the virus, you know, the nucleic acids may be around, but there may not be infectious virus. The antigen test is a protein-based test. It detects proteins made by the virus. So it probably reflects more of what's actually infectious virus. But because of the technical way that that test is done, it is less sensitive. Serology testing, which has gotten a lot of publicity, is a reflection of the host immune system getting a reaction to that virus infection. It's a blood test. It's an antibody response to COVID-19 infection. So it's an indirect measure of infection or exposure. There's two main antigens that have gotten a lot of play as far as these tests. The nucleic capsid protein, which is the most abundant protein, is usually detected in these antigen tests, though there have been some concerns that there might be cross-reactivity with other coronaviruses. And then there's the spike protein, which is the protein that's involved for getting into human cells, and it's thought that the good antibodies neutralize the interaction of this protein with the host cell. So there's a lot of interest in this spike protein, and that's actually the target of a lot of vaccines. Now, so this is a schematic from the JAMA that sort of indicates the time course. So as you recall, there's an incubation period after someone's exposed, and that is usually before someone turns up symptoms, and that is usually about a week, but it can be as long as 2 weeks. About the day before someone becomes symptomatic is when they start shedding virus. And so that's when a PCR test will be positive. And probably that's also when an antigens test would start to be positive. And as you probably all know, COVID disease is a long disease. The first week is when the virus is replicating, and then you have what's the inflammatory phase of the disease, and that's the phase that usually lands people in the hospital. And what's very confusing about testing is that not all who have detectable virus are symptomatic. And once you're symptomatic, the RT-PCR test can be positive for many weeks, but that doesn't necessarily mean that you have infectious virus. It looks like after probably the first week of infection, the virus goes away. Yes? All right. And then what you have is antibody responses, and first IgM comes up, then IgG, and IgG is what's thought to be the protective good antibody. And what isn't known now, but hopefully we'll know in several months, is how long the good antibodies last and whether people who have gone through COVID have protection that lasts. Now, you probably heard discussion about how you get the COVID specimens. The recommended test is nasopharyngeal swabs, and this is a schematic from the New England Journal. So that involves a healthcare worker sticking a swab deep, deep, deep into the nasal passages. And that can incite gagging and coughing and things like that. So you need what's called PPE, personal protective equipment, to collect the test. There are alternatives, nasal swabs, oral swabs, saliva, and those can maybe be collected by the individual, but the thinking is that some of those samples may be less reliable as far as giving positive tests because the sample isn't quite at the same level as a nasopharyngeal swab. So when we're looking at tests, how good they are, we look at, if you look at this 4-square grid, on the right is all the people who have COVID-19. On the left are the people without COVID-19. And you want a test that's sensitive. In other words, if you have a negative test, you don't have the disease. And you want something specific. So if you have a positive test, you're not picking up extra people that may or may not have the disease in addition to all the positives. And so you can calculate this based on positive predictive value or negative predictive value. So an ideal test will find all the positives, not find false positives. In other words, a positive test really will be COVID-19. It will be rapid, it will be easy to perform, and it will be inexpensive. And right now, the COVID tests all have advantages and disadvantages, but no one test actually fits the ideal test profile. And so looking at the tests that are available, the gold standard test is RT-PCR, which is, as I said, measures the viral RNA. But it's technically complex, and because of that, more expensive and needs to be done in a specialty lab, all of which means that the turnaround can be really slow. There are other nucleic acid tests that have been simplified. They're similar to the RT-PCR, but they may be less sensitive. And then the antigen test is far easier to perform, but is definitely less sensitive. Now, the biggest interest is in point of care testing, so it's performed at the clinical site, and the advantage for that is you could do it and tell the patient what's going on. Those tests are 15 minutes to at most an hour, but unfortunately, you usually sacrifice sensitivity. So in other words, you could come in, have a negative test, and actually really have COVID. Most of these tests are based on nasal swabs rather than nasopharyngeal, and there's 2 flavors, the nucleic acid test. So the Abbott ID Now is the test that was one of the first that was sent out, and that was used in the White House for screening people. There's also something that's disseminated through hospitals and clinical centers called the Cepheid Gene Expert that's actually a very, very great, strong test. And then there's the antigen test, which is, there's 2 out that are the predominant ones, the Cadell Sophia, the BD Veritor. And this is definitely less sensitive. The product insert says that it's probably 84% sensitive. Our experience in the clinics is more like 50 to 60%. And it can have false positives. In fact, the test that Mike DeWine, the governor of Ohio, had was this Cadell Sophia test. As you recall, he had a positive. When he had the PCR test, it was negative. So he had a false positive, and that occasionally can happen. So those are the advantages and the disadvantages of these tests. What we'd like is to have a lot of point of care testing available to clinicians. And then obviously we talk about antibody that measures antibody after infection, complements the RT-PCR nucleic or other antigen testing. And can be, if you have patients that have the weird manifestations of COVID that Dr. Holt talked about, serologists can sometimes sort of nail down that diagnosis if someone, say, comes in with a stroke 2 weeks after they probably had the initial COVID infection. And so you can use serology to monitor the immune response, screen for past infections, understand the epidemiology. But I think right now, for what we're dealing with, it's probably less useful, and the point of care testing is way less sensitive than lab-based tests. All right, so our current problems with COVID-19 testing are, depending on what's going on, the demand often exceeds the supply. So the turnaround time can be terrible, and with the recent surge here a month ago, you could take 2 weeks to get your test back, which is basically completely useless if you want to figure out whether you need to isolate or quarantine somebody. The testing is actually pretty expensive. The PCR, because it's more complicated, can be up to $200 to do, whereas the point of care tests are far cheaper, but not cheap. And because people are often tested because they're worried rather than they're symptomatic, insurance may or may not pay for the test. As I said, the nasopharyngeal swab requires a healthcare worker, so that also makes the tests more difficult and more expensive. But the real problem is the point of care tests are less sensitive. And for all of the tests, including the point of care tests, a lot of times you can't get all the things that you need to do it. And finally, as we know, people who are recovering from COVID-19 often have a positive PCR test, even though they're recovered and not infectious. The last thing that I'm going to talk about is pool testing, where there's been a lot of talk about that. So that is based on mixing samples from more than one individual in one single test. So basically, if 5 people are tested, you do one test, and if that test is negative, then all the samples are considered negative. Unfortunately, if the test is positive, then you need to retest all the individuals. It should save on testing reagents, but obviously keeping track of all the samples can be very complicated for the lab. You may miss out on individuals with low amounts of virus, and this is a situation where it's only really useful, if most of your population is going to be negative. And unfortunately for us, we're not quite there yet, because the recommendation would be when you want to test a lot of people for surveillance and the overall population prevalence is below 5%. So we have to sort of figure out, well, why are we testing for COVID? The obvious thing is if someone's sick, we want to make a diagnosis in symptomatic individuals and tell them what they are and advise them about their health care, keep an eye on them. But as we know, many people are asymptomatic, and those people are very important because they could be passing on the virus. And so we want to identify them, isolate them, find their contacts. We know that some people are super spreaders, but that's only a fraction of positive people. And that most of the people probably shed lower levels of virus, are less likely to spread the disease, except to people who are really close. And this is where masks are likely to be really, really important. And what we don't know is a less sensitive test that is more rapid, inexpensive, and can be deployed in vulnerable settings like nursing homes and schools, going to be a better solution than these fancy PCR tests that will pick up almost everybody but are harder to do and more expensive. So that's the end of my presentation, and I would be happy to take any questions from the group.
Okay, Dr. Kim, thank you very much for your presentation. We truly appreciate it. I don't see any hands for any questions at this particular point in time. Commissioner White, are you there? Do you have any questions? Okay.
Commissioner Miller, I'm still here. I do not have any questions.
You do?
I do not.
Okay. Okay. Doctor, thank you very much. We appreciate your presentation. Thank you. And Dr. Holt, is anything further, sir?
No, sir. That concludes my presentation.
Okay. Thank you very much. County Attorney update, Ms. Beck.
Yes, good afternoon, Commissioners and Chairman Miller. Christine Beck, County Attorney. Have a very quick first item, just to give the the board and the public an update that Governor DeSantis did issue Executive Order 20-193, which posted this week. And this order extends the ability to conduct virtual meetings, such as this one, through October 1 of 2020. And some are interpreting the order to signal that there may not be any further extensions. It doesn't explicitly say that, but that is how some are interpreting the order. Moving on then to item B. The next item on the agenda is the extension of the local state of emergency. We have provided a draft order in your backup for that purpose, and Mr. Chair, it would be appropriate to entertain a motion related to the local state of emergency.
Is there a motion to extend the state of emergency?
So moved.
Motion by Commissioner Overman.
Second.
Second by Commissioner Kemp. Any discussion? See no discussion, please call the roll.
Miller?
Pardon me?
Miller?
Yes.
Hagan?
Yes.
Kemp?
Yes.
Merman?
Yes.
Overman?
Yes.
Smith?
Yes.
White?
Yes.
Motion carried 7-0.
Ms. Beck?
Yes, so item C under the county attorney update relates to the face covering order. And as you know, we have been in court defending a number of constitutional challenges to this order, primarily based on the right of privacy, due process, equal protection, and vagueness. And just yesterday, actually, Judge Barbas upheld the constitutionality of the order, and that was following a 2-day evidentiary hearing. He issued his order verbally, but indicated that he would be preparing a written order. So as soon as that is prepared, we will certainly distribute it. And I wanted to thank Rob Brazel in my office for handling that litigation. We also have 2 proposed amendments for the board to consider, which were put forth at your last meeting by Commissioner Miller and by Commissioner Overman. And on Tuesday, we distributed draft orders that would effectuate those directives. And at this time, Mr. Chair, it would be appropriate to consider those amendments, and perhaps you'd want to start with the amendment you proposed first.
Okay. And the amendment I proposed was basically that we run the face mask order instead of approving it every Thursday. It would go until the end of the emergency order. Before I make a motion, Commissioner Overman, you recognize.
Thank you, Chair. This is more a procedural question. Will we continue to follow our previous emergency policy group's process on voting on one amendment at a time, and then take a final vote to approve the order to include those voted amendments, or are we going to take them separately?
There are amendments that would have to be taken separately, and then we'd have to approve the entire order.
Okay. All right. Great. Thank you. And I'll wait to address mine later.
Okay. So therefore, I'm going to pass the gavel to the Vice Chair and move that that we accept the amendment concerning the mask order being continuous until the executive order expires, whatever that may be. That's my motion.
Second. Okay. We have a motion by Commissioner Miller, a second by Commissioner Kemp. Any discussion? Seeing none, please take a roll for the vote.
Miller?
Yes.
Hagan?
No.
Kemp?
Yes.
Merman?
Yes. Yes.
Overman?
Yes.
Smith?
Yes.
White?
No.
Motion carried 5-2. Commissioners Hagan and White voted no.
Okay. Commissioner Overman, you're recognized to explain your amendment.
Thank you. Thank you to Ms. Beck and her staff for providing us with an order to address the changes associated with face mask mandatory order. We had reviewed two recommendations, and they were recommendations, one by the state state surgeon general, and the other by the American pediatricians. And I would like to suggest that we consider that the report that the pediatrician group put together, the Florida chapter of American Academics of Pediatrics, recommended that face coverings over the age at 5 years old. So the order that
whoa.
Sorry.
Okay, so the language that you have available for this order does offer two choices. One is at 2 and above 2 years old, and the other at 5. And my motion would be to adopt the 5 at 5 years of age.
Okay, there's a motion by Commissioner Overman.
Second.
Commissioner Kemp, you second Commissioner Kemp. Is there any discussion on the motion? Is there any discussion on the motion? Seeing none, please call the roll on the amendment motion.
Miller,
Yes.
Hagan,
No.
Kemp,
Yes.
Merman,
No.
Overman,
Yes.
Smith,
Yes.
White.
No.
Motion carried 4-3. Commissioners Hagan, Merman, and White voted no.
Okay, we're now on the amended order. Is there any further discussion on the amended order? Commissioner Overman, you recognize.
I'm
Commissioner
sorry, sir, I forgot to take my hand down.
Okay, is there any other discussion on the amended order? Hearing none, please call the roll.
Miller,
Yes.
Hagan,
No.
Kemp,
Yes.
Merman.
Can you hear that? Yeah.
I
Yes.
heard that. Yes, Merman.
Yes.
Overman,
Yes.
Smith,
Yes.
White.
No.
Motion carried 5-2. Commissioners Hagan and White voted no.
Thank you. Ms. Beck, is there anything else?
No, sir.
Thank you. Is there any other discussions that come before us today? Any other business? Any other business come before us today? Seeing none, everyone have a great weekend. Stay safe, and we'll adjourn.
Thank you.